Okay, so tonight is just a test record lecture. I still encourage you to lay your iPhone up here because I'm bound to screw something up, okay? So if you really want the lecture recorded, record it yourself. You can still lay your iPhone up here. Because I am recording the lecture, everyone has to sign that form saying, I agree not to take this recording into court and try to sue you with it, basically, right? A little housekeeping. We had to always be on time. Housekeeping for this. Okay, so you're going to go back into pause and realize that the course has been split into half. So part of you are in course, 251, and part of you are in 252. No big deal, okay? It's the same class. You're all going to be here at the same time, okay, learning the same thing. But just realize that when you go into the course, you're only going to see half of it, half of your classmates. So you can't message the whole class, but I can. So just let me know if you need to send a mass email. All right. Right. The other one is going over here. I think it started with man through Y and then A through N or whatever. Yeah. So what we need to do tonight is review the syllabi for the course and for clinical. Well, I don't need this. The clock quit working. So. Hopefully you didn't print out the syllabus. One thing that you'll learn from me is that I hate it when you print a bunch of junk because it's a waste of paper. You can simply go click it and open it up and look at it, right? You don't need to keep a copy of the syllabi in your binder to carry it around. But, it's not 1995. So, and Shane's got like a stack like this. And I have posted the cardiac slides, which I'll start on Thursday. Hopefully you haven't printed those either, because I want to instruct you to not print one slide per page. You realize how much paper that is. There's 115 slides for this cardiac, okay? So please do at least 3 on a page. Don't kill trees, all right? We only have so many. So I brought everything that I need for you to sign, and so if you brought it, we'll just use mine, all right? So this is Adult Health Nursing 2. If you don't belong here, you need to leave. If your name is not on the roll, you can stay if you're supposed to be here, but just let me know if your name is not on there, because that means you got purged or something like that. All right? So for an hour, we'll talk about lecture, maybe not a whole hour. So these are your required texts. I think you probably have everything in this list, right? You'll be reviewing your fluid and electrolytes book. You'll be using your Lenny pharmacology book and study guide. It's listed in the required text, but that's just because it's a good book to use to study. And then your Lamonian book, your MedSurg book, and I will be using the 5th edition. All right, I think everyone has the 5th edition with the stethoscope on the front of it, not the old blue one. So you can use the 4th edition, but the references to the page numbers and the tables will be different, and I'm not going to go look it up for you. So sorry. And you need a drug guide. All right. These are recommended texts, and some of them just come from the clinical course, like a laboratory and diagnostic studies book. This is what we recommend for you to get, but you can use any one that you want. You might need to use your dosage calculations book for review. These insanely easy things, I guess they're good. I've never looked at them. Mrs. Vines left those on there. What else? You guys know my nursing lab. I think you use it in Adult Health 1 or transitions. You're doing a thumbs down, but I think it really helps you review the content at least. So I can't make that required, but I do highly recommend using my nursing lab. Under the course content right here, you can see how to access my nursing lab. You just add my course, you just throw this number in, and you'll get a fresh new My Nursing Lab course. So it's simple. It's all of MedSurg. So if for some reason you still have access to MedSurg from some other class, just keep it. Don't buy another one. But I don't think you'll have to buy it again. If you bought the MedSurg Access in Adult Health 1, you can simply add a new course. So did Mrs. Livesay make it required that you have My Nursing Lab? Yeah. probably highly recommended, but we can't hold a gun to your head and make you buy something. But it's highly recommended that you use My Nursing Lab. PrepU is something that we used last semester a little bit. It is not made by Pearson. Pearson is the publisher of your textbook, but PrepU is published by Lippincott. So you can go here and register for PrepU through the point. You would go to New User up here unless you for some reason have the Lippincott access, but I doubt that you do. So you can use that. What PrepU is it gives you lots and lots and lots, thousands, of practice questions. And it gives you a level. So if you go into the cardiac assessment module and you practice with that, you don't need to write anything down. You've got it all in pause. So you don't have. Excuse me, I got sidetracked. It gives you practice questions. So if you go to the cardiac assessment section, it'll start you on what's called level 1 cardiac assessment. It's like, where is the heart? Like something really easy. And then that'll be a level 1, and then it'll work you up. So your mastery level increases. They say that normally you have to master level 3 to 4 to be at NCLEX level. It goes all the way to 7. So last semester, students used it a lot. Some of them, I got it for free for everyone last semester, and I think about half of them used it. So it's worth about $65. So they just blew that away, So I would recommend it. It's not required, but this does cost, I think it's $63 for a 6-month access. It could be a very good resource for NCLEX review. You don't have to do it. They also have what's called NCLEX 10,000. I think when I graduated nursing school, it was called NCLEX 3,000. So I guess they figured out 7,000 more questions. But it does have 10,000 questions because there was a student from last semester that answered all of them. All right, she passed NCLEX. All right. So I think some of you may know who that is. So that's PrepU. And to figure out PrepU, you come right here, and I just typed up a little document for you, and you can see how to access it. Anyway. Yeah, there you go. It has a course ID just like PrepU does, and excuse me, My Nursing Lab. So there's the links. Go in there, purchase the stuff, and make an account. If you want to. It's recommended, not required. All right, let's talk about how you guys get a grade. So you get a grade in here by taking tests, and that's it. All right? You don't get a grade from the HESI. So in your other classes, I think you got 5% in most of your classes from taking the HESI. Here, you don't get any credit for the HESI because technically Adult Health 2 doesn't have a HESI. We connect the exit HESI to Adult Health 2. So the HESI for this course is the comprehensive HESI. Day 1 of orientation to the day last of this class. All right, so everything is a comprehensive test. So you have 4 unit exams. Each unit exam will have 5 lecture days on it, except for the last exam, and that will have 6 lecture days on it. The last exam probably is the least difficult. So each exam will have 5 lecture days, and if you look at the day by day, you'll see that. Those 4 exams count for 65% of your total grade. Each exam is 16.25%. That's pretty nice. So only 16% per exam. And then the final was, 35%. So you've heard the dreaded test 1, right? Yeah. So test 1 is a little bit different now. I've changed it a little bit, and you've probably seen that in the day by day if you've been able to access it, because we had problems with PALS today, and it was saying error, file not found or some junk. But they were in the process of recloning the courses because we added that second section. So that's 35% of your grade is the final. Each unit exam is 50 questions. You get 1 hour to take it, and the final exam is 100 questions, and you get 2 hours to take it. If you are a special accommodation student, meaning that you know who you are, if I said that, if you need more time for a test or whatever, just bring me the documentations and we'll work it out for you. Let's see. So let's talk a little bit about the HESI, not too much. You have to make a 950 on the HESI to graduate, right? So we link the exit HESI to this course. If you don't get a 950 before final grades are due, you simply get an incomplete in Adult Health 2. And you don't get a grade until you get a 950 on the HESI. All right. I think there's only 2 people still lingering from last semester. So it's some people take it 3-4 times, but that's okay, because the first time that you take it is the day after the final and the day before pinning. 3 people might pass it. I don't know. I think 7 passed it last time. That's pretty good odds, though, because I think there were only 35 people. There's 45 in here. So, all right. Does that all make sense? You have to pass it within 12 months. All right. So if you don't pass it within a year, you will have to repeat Adult Health 2. All right. And if you don't, and if you've repeated a class before, that'll be a big problem. All right. So we don't want you to make it all the way to the end and not be able to do anything with with all this education. So that's that. I think you know the grading scale by now, right? 77.5. All right. 77.5 makes a C. All of you have gotten over this thing where you need an A or a B in a class, right? You just want a 77.5. Because I try to remind people that the grades that you get in this program stay at Southwest. They don't transfer anywhere. You're going to get a license as a nurse and go to University of Memphis and say, here, give me credit for classes, and they give you all credit for all those classes again, and they're simply P's on your transcript. So you saw your way through with C's at Southwest, but they just give you P's at University of Memphis. And then you make all A's, and you have 4.0 again. All right, so don't worry about it. I try to explain this to the foundations people, but they just can't get it. They don't understand, but I think y'all understand it now. The way that I communicate with you guys is the way that I communicate with you guys is through pause. I like to keep pause as students, and I like to keep the other email with all the people across the street, administration, because you get lost. I get 30, 40 emails a day sometimes, and then your name pops up and it gets lost in there. So I don't want to lose your email. So just communicate with me through pause. All right, I think it's easiest. But you can email me in regular Southwest too. But just whatever. That's my preference. We have to recommend that you sign up for this emergency messaging system. It's called the RAVE system. So if you are in clinical, it's Monday morning at 5 o'clock in the morning, and we're all the 7 of us are getting ready for clinical, and there's 2 inches of snow on the ground. Well, hopefully you've gotten a text message that says, go back to bed. Don't call me and ask. You will get a text message or an email saying school is out. If the school is closed, no clinical, and you do not have to make that clinical day up if it's a snow day, all right, or flood or whatever happens. So don't call me. Just sign up for that, all right, because I'm going to go back to bed too. We talked about disabilities or whatnot. What's happening? Don't do anything stupid on the computers. I don't think anybody has beepers anymore unless you're on call. But keep your cell phone on silent. And I think some of you, if you've never taught a class, maybe you don't realize that I can hear almost everything that happens in this classroom. Everything bounces off this front wall. So even if Lori's cell phone is in that bag vibrating, I can hear it. So it distracts me. So I've probably gotten off track about 3 times already in 15 minutes. So I don't have a good train of thought. So just put it on silent, all right? Not vibrate, just silent. Or turn it off. I don't care. Just don't let it disrupt the class. Especially when you have it laid up here. So there's 45 people in here. This is going to be covered with iPhones, right? And it's inevitable. Every class period, something starts happening up here, and it distracts me. And I have to find the one, and I just cut it off. Sorry, your recording ended. So just let your cell phone not make noise, especially if it's laying on the table. You can put it in airplane mode if you have an iPhone. All right. Especially when you're taking a test. Please, God, don't let your cell phone go off during a test, because you will just have to. I'll get kind of mad. Okay, so you might have to walk out of the classroom. So we'll talk about testing procedures in a minute. Let's see. If you guys get financial aid, realize that if you decide to drop this course before 60% of the course has completed, that means anytime before fall break, because fall break's about 50%, you may have to pay back some financial aid. All right. I doubt that's going to happen in this class. I tell students to not get pregnant when they're in nursing school. It happens, right? So hopefully, we had a student last semester. She gave birth on the day of the final. It worked out. I think she's a nurse now. I don't know, but yeah. So let's see. So hopefully, even if you're pregnant, you can finish this class. If you need to drop a class, don't simply get on Mike Southwest and go drop the class. That's a big mistake. All right, we need to consult with you and advise you before you drop a class, because if you drop this class and you took test 1 and you got a 76, you do not have a passing grade in the course. And if you drop while failing, that counts as a failure in nursing. So if you decide, I can't do this right now, I've got to drop this, you must drop the course before the first test, or pray that you pass the first test. So at the time, so everybody's passing right now, so at the time that you drop the course, you must be passing, or it counts as a nursing failure. Does that make sense? All right? I think you've heard that speech before. All right? Don't cheat. It's stupid. I'll just kick you out and give you a 0. Okay? You are responsible for understanding and reading every word of the handbooks. All right, having said that, we do have Learning Enhancement Services again. Her name is Mrs. Martha Simpson. She is an old nursing professor. She was here for, I think, about 30 years, and she retired about 5 years ago. And she's come back part-time to help us with remediation. So if we get into respiratory and you just can't comprehend some patho in respiratory, we can write you a prescription. You can go over there to Mrs. Simpson, and she will help you with extra materials on understanding that content. Realize that she is working part-time. She is here only 20 hours per week. So come to me first if you need extra help. If I can't resolve your problem, we can refer to Mrs. Simpson. All right? And somebody in here is probably thinking, oh, I need to practice IVs. She's not doing skills practice, okay? Because she can't, look, there's 250 students in this program, all right? All right, so let's talk a little bit about testing. You guys have taken tests, lots and lots of tests in this program. We do paper testing. So I think the only courses that do computer testing are Adult Health 1. I think OB is now doing computer testing. I would like to do computer testing because you get an immediate grade and immediate feedback, but you don't get a lot of statistics about the question. I can run statistics on a question, and it tells me if it's a good question or not. So maybe only 40% of the class got it right, but it has a really good statistic that tells me all the people that made a good grade got it right, but all the people that make a bad grade got it wrong. So that tells me that it's still a good question, but PAWS doesn't do that. So we're staying on paper for now. We talked about 50 questions for the unit exams and 100 questions for the final exam. The exit HESI is about 160 questions, and it should take you about 3.5 hours. I've allotted 4 hours for the HESI. As you know, if you don't finish the HESI, you don't get a grade. So you have to finish it. But, try to pace yourself, because on the NCLEX, you could have upwards, what's the max number on the NCLEX you can get? Like 256 questions? An insane amount of questions, and you only get 4 hours to do it. So this is practice for the NCLEX. So we can't give you a whole day to take the HESI when the NCLEX only gives you 4 hours. Okay, you guys can read. I'm not going to read it all to you. 1 hour. We keep the doors closed until you take the test. We just encourage you to leave everything in your car at home when you take a test. There's really no reason to bring anything with you. I always encourage students not to study just before the test. You need to sit down, get some carbohydrates in your blood, and just rest your brain. So hopefully you're not sitting outside with the book at the last minute trying to remember something. So it always happens, but you're not going to remember that material, so just stop it. So just leave everything outside. If you have to bring your purse in, just put it up under your desk during the test. You cannot wear hats during a test. You cannot wear anything in your ear during a test. A couple of summers ago, somebody got a 0 on a test because they had a Bluetooth in their ear during the test. Sorry. It wasn't my class. Thank God. Let's see. If you have a jacket, you have to have it on, or it's up here at the front of the classroom. It can't be hanging on the back of your desk. You don't need calculators for the test because we don't have dosage questions on our test. Those are gimme questions. They're freebies. It inflates grades. So we don't have any dosage questions. NCLEX does. But we don't. Let's see. So before you take a test, I think you've probably done this before, but on the front of the test, you need to write your name, and on the subsequent pages, you need to initial the top of every booklet, of every page in the booklet. Only what you mark on the Scantron is what counts. I don't care if you've circled B on your paper, but you mark C on the Scantron. It happens every single test. Somebody messes up. And they miss 2 points at least because, I mean, not everybody does it, but somebody on every test does this. And they get real upset at themselves. And I feel bad for them, but, you know, only what's on the Scantron is what counts. So what I recommend is actually bubbling in your answer first and then going back and marking the booklet after you're all finished. Because going back and forth, you get off track. I've never had somebody to actually completely get off track, you know, and then, you know, like they're one question off, and so they're answering 56 for 54 or 55. That would be a disaster. But so just be careful because it's only what's on the Scantron is what counts. What else? I've never had to send somebody out and give them a 0 on a test, but I mean it's possible. Let's see. You can bring your own pencils. Yeah, erase good, blah, blah, blah. Okay. So these are the guidelines for HESI testing. I think this is pretty much the same as everything else. You know, you retire, be on time. You know, we take the HESIs on the computer. Everybody needs to remember their, is it Elsevier? I think it's Elsevier, their Elsevier account for the HESI. So you don't want to create a new account, then you've lost all access to all those old HESIs that you can't review anymore. So try not to make a new account. Keep the one that you have so that you can review all of your old HESIs too. You can see how you're progressing and where you need to work on things. Okay, let's see. That's all that. So, like I said, everybody has to sign this, whether you're going to lay an iPhone up here on my desk or not, because I'm going to be using Tegrity for all recorded lectures. So everyone will have access to the recorded lecture, and in theory you could, you know, copy that lecture onto your own computer or whatever, and then if you get mad at me about something, say, well, you said in class. Can't do that because I'm a human and I make mistakes. So the ultimate last word is the textbook. All right. So you can argue the textbook, but you can't argue what I said. All right. So that the recording is for your personal use only. You're not to use it to show your friend what I sound like and make fun of me. You know. I certainly feel bad for you guys that you will listen to my voice over and over again. It's just terrible to me, but. Yeah, I had a student tell me that over the summer he went to New Orleans or something, and on his drive back and forth he listened to all the lectures again. Whatever. So you know, all right. So that's that. You have to sign that form, and you're responsible for every word on it. This is the acknowledgement form saying that we have gone over the syllabus. I didn't cover every word on it, but you are responsible for every word in the syllabus. It is our contract between instructor and student, okay? And I will give you the form. It's this form here. I'll give you this form to sign. Your name must be legible on it, and you have to sign it. This will go in your permanent student file. All right? Oh, I'm not going to look at that stuff. All right. Too much stress for right now to look at that. All right. Yeah. We can glance at one. Okay, I'm sorry. All right. So So some of the units have these outlines. It's a nice thing to kind of organize yourself to study if you like, but we do cover everything on those outlines. And also, we have the detailed learning outcomes written out for you. So this is the learning outcomes for the neuro section. So you can see I will cover every outcome over here. The best way to study for my content is to study the PowerPoints, study lecture, and make sure you know all of the learning outcomes. So don't go, I guess I can't say that, but I have never, in my education, read a textbook. I'll go and use it as a reference, but for me, it was a waste of time to sit down and read 7 chapters for a test. I try to understand the content from the lecture and the notes and use that textbook as a reference. If you have to go read it, that's fine. But if you come to lecture every time, you understand the PowerPoints, you study those PowerPoints, and you make sure that you hit all of these learning objectives, I think you'll probably be just fine. There's some extra resources over here for you. All right? So that's just the learning outcomes. I think I would kind of focus on those. That's the syllabus for the course. Let's see. Let's go through the rest of this. The nursing handbook is in every nursing course. You're responsible for everything in the nursing handbook. You've already signed something about that during orientation. Here's our daily schedule. Some of you probably haven't seen this yet because it was down for a while. But so let's look at the day-by-day schedule. All right, so today's August 27th. What I did on here is I started with cardiac. It's always a good unit to start with. I think it's probably one of the top, most difficult units in this course. But partly I think that it's the most difficult because it's just the first one. The first test in any course is the most difficult. You have to figure out a testing style and technique of the teacher and all that stuff. So what I did was I put the 4 days of cardiac up front. And then that first day of respiratory, which is September 12th, those are the 5 units that will be on Exam 1, the 5 days of lecture that will be on Exam 1. All right. In the past, it was done a little bit differently, but I felt like I should make it more even, so that's what I did. I would always tell the students in previous semesters that they would say, "Why can't we do it this way?" I'm not the boss. I don't know, but I am the boss now. So of this course anyway, and so this is how it's going to be. So your first exam is September 17th. It's kind of quick. It comes fast. But for me, I like to get it out of the way. I don't like to drag it all out, and then at the end of the semester, it's just test, 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 boom, boom. So I'm going to try to even it out over the semester a little bit better. So. And next to the units you see next to cardiac there's an S by it. That means SASSR. So I do all the cardiac. I do all the respiratory. I do all the neuro. I do all the endocrine. All right? So Exam 2 will cover respiratory. You see, so it'll be respiratory 2 and 3 on Exam 2, and also the 3 days of neuro. So, and then you have, then we'll start up endocrine after the test. We don't lecture after exams. It's just, we don't have to. When you take a class that, the half semester courses, you kind of have to. You have to get that time in, but you take the test and you go home. All right? And within a couple, 3 hours, I'll have the grades posted into Paul's, and you'll be able to see what you got. All right? Fall break is October 14th and 15th. And 17th. Okay? So I extended fall break for us. But that's because we had enough time, so I did that. I don't know. We'll look at that in a minute. I can't remember what I did. I think you still have clinical. So that's that. So, Ms. Cage will start teaching on Halloween, all right? She will teach the first part of immunology, which I think is myasthenia gravis and multiple sclerosis, and I'll do the rest of it on the next day. Ms. Cage also is going to teach all of renal. All right. So realize that exam 3 has all of endocrine and the 2 immunology units on it. Okay. And then the 4th exam down here on December 5th, that has all of renal, those 2 disaster days. Ms. Cage will do the first one, I'll do the second one, and then tentatively Ms. Cage will do the leadership, management, community. It's like triage and delegation stuff. So we reinforce that delegation material in this course. Dr. Mashiri also teaches about that, but we want to make sure that you understand it. We drill it into your head, because if you do well on the NCLEX, those are the kind of questions that you're going to get. All right, it's going to be all time management and delegation and prioritization. So if you're getting all those types of questions, you passed it. But so we want to make sure that you can do that. All right, so exam 4. Like I said, all of renal disaster and the leadership day is on December 5th. So that's the one exam that has 6 lecture days on it. Don't get upset about that. So I'm like, all the other ones had 5. Well, we'll probably get out of here in an hour on both disaster days. Okay, so really it's the same amount of material. Those are shorter lecture days. All right. The final is December the 10th. All right. I think the final is at 4. I'm not sure, because the final schedule is different than the normal schedule, but it might be at 5. I'm not sure, because you guys don't have a final in management, right? You just write a paper or something. You don't have to be here on the final day to sit down and take a test. So we have some leeway with that, unless, because some of you might be taking another class. Some of you might be taking statistics or music appreciation or something like that. So I still kind of have to stick to that schedule to make sure that you don't have a conflict with your final day. What? Okay, but you don't have to come here. It's online, I think. Yeah. So, okay. So the HESI will be the next day. So you're like, what? So I just want to give you one chance to take it. Early. Some of you pass it. Some of you will pass the first time. So then the next day is pinning. All right. And hopefully all 45 of you will be at pinning. That's my goal. What else? Oh, yeah. So, okay, here's the bad news. So, like all of that was good news, right? So, we have a mandatory NCLEX review course. So, if you don't pass the first HESI, the NCLEX review counts as your remediation for the second HESI. Just because you pass the first HESI doesn't mean you don't have to come to the NCLEX review course. Everyone must come to it. We pay a lot of money for it, so you have to come. It's 3 days of somebody up here talking at you, and you're going to get bored, but I had to sit through it too, so when I was a student. So that's that. And it'll be pretty much an all-day thing. I think they start at 9 and end at like 3 for 3 days. So bring breakfast and lunch with you, and maybe a picnic blanket. Some company, I don't know. Some lady comes in from somewhere else and teaches it. You had a question?
You just answered my question.
Okay, yeah. So make your schedule now. All right. Having said all that, some of this might change. All right. I remember being in college, and I think I'm fairly intelligent, but I could never figure out how to read an instructor's office hour schedule. So I'm going to help you. So right here, let's see, I don't want to draw on it. Let's see. So right here is where we are. Okay. So adult health nursing 2. That means during these times on Tuesday, I'm going to be in here in class with you. All right. So from 5 to 7 on Tuesdays and Thursdays, that's where I am. On Mondays, I'm in adult health nursing 2 clinical all day long. All right. I also teach dosages 2 sections on Wednesday and Thursday from 2:30 to 4:30 and 1:30 to 3:30 on that day. All right. So that's where I am. If you're calling me, I'm lecturing. Okay. And then don't call me though. And this is my office hour schedule. So on Monday, I'll run over here after clinical and sit in the office for an hour in case you need me. Because you guys will be here on Mondays for management, so if you need me, I can be here. Some days I might need to run home or whatever, So if you need to meet with me, let me know beforehand so I can make sure that I am here for sure. On Tuesday, I'll be here all day long, okay? I'll be here for 8 hours on Tuesdays, so I'll be here at about 11 o'clock on Tuesday morning, and then I will come to class with you guys and leave at 7 o'clock with you guys, all right? And then on Wednesday, I'll put my office hours around that class there, and then after the class on Thursday, I am kind of out of pocket on Fridays, but I will answer your email on Friday, but I can't meet with you on Fridays, all right? Or Saturday or Sunday, all right? That's my weekend. Friday too, all right? So this is my office phone. This is the phone number for the unit that I'll be doing clinical on. So for you guys that are in clinical with me, here's the unit number for GICU, all right? So that's how you read an instructor's office hours. So, like I said, I went all the way through college. I was like, I don't know, where are they? I don't know. Miss Cage has office hours too. I guess her office hours are in French. Okay. Looks like ours. That wasn't funny, huh? What else do we need to look at? Okay, here's some course content. Everything here was left over from Mrs. Vines. I've just left it there for now. Don't go printing everything out. I might just delete it after a while. But the only thing here that is mine is the cardiac PowerPoint. So you want to go open that up tonight and save it on your computer and print it out. Does everybody know how to print PowerPoints correctly? I'm going to show you anyway. So and print those out and bring them to class on Thursday. Hopefully a lot of you have done your TCPS stuff. We'll talk about that in a few minutes, though. Do what?
It got hard.
I had to take it 3 times.
Look, at least we don't feel so bad. They changed that graphic. It's a lot harder.
Because you learn shortcuts when you actually have to do it every single year 3 times. Let's see. So to print a PowerPoint, all right, so a lot of times people just go here and print and just start printing. Well, don't do that, all right, because what you're printing is full-page slides. You're going to print 115 pieces of paper, and you're going to go, oh, my God, and then you have to go to Office Depot and buy some more. So select somehow to do it. I like to do 3 slides per page. I've thought about actually saving it in PDF format like this so nobody prints out a whole page or 1 slide per page. But I want to give you the autonomy to do it how you want. But I absolutely recommend not doing anything less than 3 slides per page. All right, because that still gives you 39 pages. All right, that's a lot of paper. You might, if you could do front and back, that might be nice too. All right. All right, so let's see. We can solve these at the end. What questions do you have about the course, Adult Health Nursing 2, the lecture?
You said that you can download the lecture recording on pause to your computer?
I think so. This is the first time I've ever made an integrity lecture, so I think so. So we're going to see how it works. So that's why I still recommend that you lay your phone up here and record the lecture if you choose to do that. It looks like it's still working, so we're okay. But I think I can copy it to YouTube as well. So if you can't figure out, because you guys are in 2 sections, right? So the course is split in half. I'm recording in 251. 252 may not be able to see it. So I think I'll put it on YouTube, and then you guys can go to YouTube to find it. All right. But I'll have to figure that out. I'm lucky to have gotten this microphone to work. So what else?
With the HESI test, back before we knew what we were doing with passwords and everything, is there a way to retrieve your first remediations from like foundations if you need to?
Yeah, okay. So when you guys, so let me see if I understood your question. So when you guys were in foundations or transitions, you probably didn't use the HESI iNet. Is that what you're saying? I don't know. Yeah.
I've seen access to a few of them.
I think what we did, I know what I did then is I printed 2 copies. I printed one for your file, and I gave you one to go home with. So hopefully you have that printed copy somewhere. Yeah. You'll eventually learn, if you haven't by now, that you don't throw anything away. And if you do give something to Deb, the secretary, to be put in your file, you consider it to be thrown away because you will never get it back. What I recommend you do, because you guys will be nurses soon, and you have to keep up all of your professional licensure documentation, all of your CEUs, especially if you live like in Arkansas and you require CEUs there. And somebody's going to say, show me what you got. And you're like, I don't know where it is. Scan everything that you have. Just scan it and put it into a document on your computer, and then you can never lose it. So every 2 years I have to go renew my BLS, my ACLS, and my PALS. So then what do? I scan it onto in the thing, and it's in my computer. So I don't have to worry about keeping up with that paper copy. Some people keep it in their wallet. Whatever. It's not like you have to pull it out and say, yes, I can do CPR, you know. So just scan it and keep it in your computer. So therefore, when your clinical instructor is like, I need to see your BLS, you say, okay, click, print it out, here you go, you know. So I think I told everybody this at orientation, too, 4 semesters ago. So hopefully you've done that. All right? What else? All right. So, well, this is going to be fun. Yeah. It's been pretty stressful for me up until now because in the past, Mrs. Vines has just done everything with the class. I just have to worry about clinical. But now I have to worry about everything, coordinating the whole class and coordinating all the clinical. So it's been a little stressful. So now I feel a little bit more relaxed because I've got everything ready to go. So now your stress starts. But yeah, summer is over.
I want us to reflect well on me.
Yeah. If you're walking around stressed, like, what's he doing to them?
Time is usually my limiting factor on my stuff. Do you recommend the prep or the nursing lab?
Here's the difference between the two. My nursing lab is more focused toward course content, in that you go in, you take a pre-test, which is about 10 questions, I think. It tells you where your weaknesses are and your strong points, and then it tells you what things you really need to review, and it gives you an outline and actual content to review. When you're finished doing it, you take a post-test and you see how you improved. I think in the past you were unable to see those quizzes again, so you would take it and then you could never see them again. Well, they've changed that. Now you can actually review those quizzes again and look at those questions a second or third, whatever time. PrepU is questions. It's all questions. So you go in and you say, I'm going to take 5 questions on endocrine, and it'll give you 5 questions. If you get them all right, you'll bump up to level 2, and it'll give you 5 questions at level 2. When the guy came to talk to everyone last semester about PrepU, and he said to make sure that you're only doing 5 or 10 questions at a time. If you do more than that, you probably aren't going to pass it. So you're probably going to get a couple wrong, so it's still going to keep you at that level 1. So just do 5 or 10 questions. If you do PrepU, 5 or 10 questions at a time. And you will notice that the questions are repeated sometimes, but that's okay. You still get lots of nice, fresh questions. And PrepU is interactive. It's performance-based is what they call it. Like the NCLEX is performance-based. So if you're answering low-level questions and you're not getting mid-level questions right, it's going to keep you at low level, and then you just fail the NCLEX, right? But if then it starts you out at a high level, and you keep getting high level right, it keeps you there. So that's what PrepU does. If you bump yourself up, and then if you're answering these high-level questions, it keeps you at that difficulty level of questions. So it's interactive, and it's nice. I know to some of you, $60 is a lot of money because, you may be working only 10 hours a week, but, that's why it's not required. I can't make you buy anything. I can only highly recommend things. But that's the difference between the two so that you can make your decision on which one. But probably most of you will not have to pay for my nursing lab again. Because if you were in Adult Health 2, you would have been in Adult Health 2, a year ago, Adult Health 1, a year ago, and you have bought, at that point, you bought Med-Surg Access. So you can add 16 courses of Med-Surg, but you only have the Med-Surg access to Lamone and Burke, your textbook. If you, last semester, you decided to buy My Nursing Lab for peds, that doesn't work for us. You'll have to rebuy the Med-Surg access. Okay, does that make sense? So if you've already bought it less than 2 years ago, just add this course and you go at it again. For transitions, some of you are LPNs. I don't know if they required My Nursing Lab for transitions. They probably didn't, but they probably recommended it. So if you have Med-Surg access, you can still use it. All right, so possibly it can be free. Not free, but you can use it again. All right. My intention was to see if everyone that used PrepU passed NCLEX and all that, but those are bad statistics because everybody passes NCLEX. So, you know, if you graduate, chances are you're going to be a nurse, all right? Because last year we were 100%. Everyone that took the NCLEX in 2012 passed it the first time. And so far in 2013, everyone that has taken it has passed it the first time. So you guys will be 2014 testers because you'll graduate in December, so you don't count for this year. So you don't graduate until December, you know. I don't know much about the registration for NCLEX. That's handled by Mrs. Livesey, who is the new department chair, and Deb, the secretary, knows all about that. I just know you need a picture, and I take care of that for you. All right. Picture day, do you know what it is? It's scheduled. Picture day is set. I think it's on October 11th, maybe. Is that a lecture day, October 11th? Shane's got everything printed out.
No.
It's not 12th, 13th, something like that? Maybe it's on the 10th. Maybe. I don't know. Sometime around there.
Everything after that is fall break, so.
Yeah. I try to do things early, get it out of the way. And I think I put it on a non-test day, because that really messes people up. So, you know, you have to go get your hair done, your makeup done, and for the pictures, and then you have to come and take a test afterwards. So everybody looks stressed in their picture. But, all right. Do you want to take a short break, and then we'll talk about clinical? Okay, just like 5 minutes. Here we go. You'll have lots of questions about clinical, and I'm going to do my best to answer them all. Okay, I'll pull mine up. I didn't put the syllabus in here. Dang it. Is it going to go away? I guess not. Let's see, maybe, because I don't want you to see my password to this place. Okay, so here's the syllabus for Adult Health Nursing 2 Clinical. As you know, everyone in here is also registered for clinical. You have to take clinical with lecture, all right? So here's some of the instructors. We got a couple more, too. So the purpose of a clinical is to reflect the content of a course. Everyone will have some sort of critical care clinical experience at some point during their clinical. It may be the first 5 weeks, it may be the last 5 weeks. It'll be in there somewhere, though, all right? So just keep that in mind, that you will have the opportunity to be somewhere in an ICU. People get real excited about that, and sometimes it doesn't work out, and ICU gets a little, you know, just a small bit of it for some students, but I've done my best to include as much ICU experience as possible. Let's see. Let's just look at the textbooks for clinical real quick. You again need that fluid and electrolytes book. You need a laboratory and diagnostics book. You need the textbook and a drug guide. I would recommend you having a nursing care plan book as well. Hopefully by this time gotten to where you can kind of make a care plan without looking up every single intervention that goes along with the nursing diagnosis. At least the assessment ones, ineffective airway clearance, you might want to assess the airway patency, right? So you figure that out by now. But just make sure you have plenty of resources. And if you don't know this, the library here has lots and lots of online resources for nursing. So there's a free electronic version of a drug guide. So I'd encourage you not to go and copy and paste things from somewhere, but I know that happens, and it's realistic that you will do that. But at least edit it, right? Make sure that it's applicable to your patient. Don't give a list of 1,000 side effects of a medication, because I'm certainly not going to read them all. So everybody, you guys are the last group to wear that wonderful uniform. Aren't you happy? So you have to have your uniform and all that stuff. A lot of people will ask me in clinical, do I have to wear my lab coat? No. Bring it with you to clinical, but when I'm working in the hospital, if you're really working like you should be, you probably should break a sweat every once in a while. And it gets hot. I get hot real easy, so I don't wear my lab coat all the time, especially if I go in a patient's room who's in isolation. So no, you don't have to have your lab coat on at all times. I encourage you to tuck your shirt in if it looks okay. Some of you still have those nice elastic bands on your pants, so I know that looks terrible. So as long as your shirt looks decent, untucked, I'm okay with that too. Okay, you guys have everything you need for clinical, I hope. Again, communicate with me or your clinical instructor through PAWS or how they direct you to communicate with them. I think Chandra O'Brien, for you people that will be at the VA, she likes to communicate through her Yahoo email address or text messages. So I got that same text yesterday, all right? Or maybe it went out today. So get that stuff done for the VA. Because if you neglect to get something done, and you miss the first day of clinical, well, you have to make that clinical up. All right, so get it done. Hopefully, you guys are ready to be sworn in if that hasn't happened already. You guys are familiar with TCPS. Everyone here must complete. And I don't care if you did it last semester. I don't care if you did it over the summertime. You have to do it again. All right. Everyone does it in the fall. So everyone has to do the general orientation quiz and print their certificate saying that they passed. They then will scan it into their computer, right? And show me a copy of it, all right? You also have to do your facility-specific orientation. A couple of you are not aware of where you will be for clinical, but we will talk about that in a minute. You also have to make sure that your clinical passport is up to date. Hopefully, at least some of you have come tonight so that I can look at it to make sure that you are up to date on everything. It's inevitable that every semester somebody has made their way all through this doggone program and didn't have proper documentation of a hepatitis B series. I don't know how it happens, but it does. I got something one time, somebody just wrote on a piece of paper, patient has had hepatitis B series. That doesn't work, okay? I have to see a titer or I have to see your vaccination record, all right? A statement by a physician doesn't really cut it, all right? I mean, if it's, if it looks, we'll case by case, but everyone has to have a Tdap or some sort of tetanus within the past 10 years. Everyone must show immunity to varicella, which is chicken pox. Everyone, because when you go work in the hospital, you have to be immune to it, all right? You're going to be in the hospital taking care of patients. So every time you're employed by someone, you will have to show immunity to varicella. So you have to show immunity to that. Measles, mumps, and rubella, all three. If you only have mumps and rubella, that doesn't mean that you're also immune to measles. Those are three different antigens, right? So we have to see all three. Or see your vaccination record. What else is there? Hepatitis B. You have to have 3 hepatitis Bs. Hopefully you guys have already gotten that done. TB skin test has to be up to date within 12 months probably somebody's TB skin test is going to expire in the middle of the semester. Don't let it happen because you can't go to clinical if you have its expired TB skin test. You will have to make up that clinical day. And that's just a pain in the rear for all of us to have to make up a clinical day, especially you guys. What else is there? You have to have a flu vaccine. Look, y'all, a flu shot is very safe, okay? If you decide that I'm not getting a flu shot, well, okay, you have to wear a mask at all times while inside that hospital. Don't do that, all right? I recommend do whatever you want, but get the flu mist. It's better immunity. It's a live virus, and it produces better immunity to the flu virus because it is live. And also, it's absorbed immediately into the nasal mucosa, and you start building immunity to that flu vaccine almost immediately. If you get it injected, it's attenuated, dead kind of, and it takes a while to build immunity, even if you do build immunity with it. So if you don't have asthma and wheeze all the time, get the flu mist.
We have to get another one. If you have one within a year, it's not like TB.
Remember how it works. So there's a flu season every year. So no one has had a flu shot yet. All right, you can get it at the beginning. They're starting to come in now, so your provider might have them in. If you have worked for a hospital, go get it for free. So if you have health insurance, run over to CVS, get it for free. But yeah, soon you'll be able to get the flu vaccine, but not yet. So nobody is compliant with that right now, right? Not even me. They're already at Walgreens? Oh, good. All right. Okay. Yeah, they probably just got them, the flu vaccines. 12 months. So if a TB skin test is good for 12 months, if for some reason you are a person that has a positive TB skin test always and you don't get a TB skin test, your chest x-ray is good for 2 years, right? What else is on that form? Oh, and I think maybe one of you are pregnant. You can get the flu vaccine when you are pregnant, okay? You have to get the injection, though.
But on the varicella, because in the semesters past, they didn't make us get a titer if we were a certain age, before a certain age, but we do now.
Yeah, so let me explain that. There was a big controversy over this, and they kind of blamed it on me. So the thing is, the college, if you're a regular college Southwest student and you're not in the clinical area, if you're born after 1980, you have to show immunity. If you're born before that, you don't. But everyone in here is in the clinical setting. So we have specific requirements for the nursing department. Everyone must show immunity to varicella.
You go to the health department if you had it and tell them you had it, and they'll put it right on your shot record. You do not completed the shot. Tell me you had chickenpox when you were 5, they'll calculate the year.
Yeah.
Right in.
Yeah. Okay, having said that, just because you have the chickenpox disease, that does not prove immunity. Okay? I have to see that you got 2 Varivax vaccines, or I have to see a positive varicella titer. All right? Okay, let me give you an example.
That's prior to clinical. Okay.
So when I got to nursing school, they were like, go get your varicella titer. I said, okay. I went and got it. I was not immune. When I was 5 years old, I remember sitting on the living room floor having chickenpox. I wasn't immune to chickenpox just because I had it. You don't want to get shingles, okay?
Well, they put it on my shot record.
I don't care what they did, but when I'm telling you the correct thing to do.
Oh, I'm just making sure if I need to
Yeah.
give the shot now.
You need to show immunity somehow. Yeah. Sorry. All right. Hopefully you have health insurance. If you have health insurance will pay for a titer. All right. It's free.
Hospital's going to make you do it anyway, right?
Right. Yeah. They're going to do it again, really, but we need to. You have to show immunity to varicella. End of story. All right. Your mama giving me a statement that you had it when you were 3 doesn't count. Yes, ma'am.
Not all insurances cover the titers.
Okay. Well, you have to have it.
Yeah. Well,
Yeah.
just saying.
Yeah. So it might have been the way that your provider billed it, though. I don't know. So, but anyway, there you go. I'm sorry. Here's another unexpected expense, maybe. What else is on that form?
Yeah, the CPR.
Everyone has to have has to be BLS certified, right? So within 2 years. It's good for 2 years. Probably somebody's is going to expire during the clinical. Just don't let it happen. Because if you let it expire, you have to go through all that training again. You can't just do the recertification. So make sure that you stay current with your BLS. Okay? What else is on there? All right. So that's TCPS. They're going to start getting loud out here. Let me close this door. The financial aid statement also counts for clinical. If you have to withdraw from this course before 60% is over, you might have to pay back some money. Everyone has had a background check. Let's see. These are some things, obviously, that you'll be doing in clinical. You're giving medications. We might have what do you call it? Health fair day. We may find some stuff for you to do outside of the clinical setting. I think every fall there's I know that there's a conference every fall in Franklin, Tennessee. I think somebody went last year. So if you go to that, I'll give you a clinical day. And SNGA will pay for the registration fee, but you'll have to provide your own transportation and hotel stay. So we pay for the registration of the conference. I think it's a little expensive, so I think I'm going to decide how many we will pay for. So not everybody can go because we just break SNGA, but so let's keep that in mind. That's what I'm talking about. It's in Franklin.
It's in November the 7th through the 10th. So Thursday through Sunday. It's in Louisville.
If you go,
close to it's in Louisville. So.
If you go to a conference, a nursing conference, I'll give you a clinical day. Yeah, but you have to show proof that you went. You guys bring a lot of literature and stuff like that. Prove that you went. All right. I think you guys know how clinical is scored. You don't get a grade in clinical. Either you pass or you don't pass. And in the final evaluation for clinical are some starred items. By the last clinical day, every starred item you must be proficient in. And they're pretty vague and general, so, you really have to mess up to fail clinical. But don't tempt us, okay? Because people do fail clinical in this program. So just be on time, be there, do what you're supposed to do, be prepared, and take care of your patient, and you will pass clinical. And don't do anything stupid, all right? There you go. This goes for any course. You have the right to appeal a grade, and it is your burden to do so. You will start the grade appeal with who? Your teacher, right? So if you're like, I don't think my grade's right, all right, let's sit down and look at Excel and make sure I put everything in right. Maybe that was a problem. You don't want to go to Dean Stevens when I could have just corrected a number in the Excel spreadsheet, right? We talked about withdrawal. We talked about my office hours, so if you need me for clinical, you can certainly drop by or give me a call or an email, I prefer. Or your clinical instructor is also available through email, text, however they instruct you to contact them, all right? You're thinking, well, how do you cheat in clinical? People have done it, all right? I think it was maybe probably a couple of years ago. There was a unit, and there was this one patient on that unit, and it was a really good patient, and the instructor was passing to make sure everybody got this patient to take care of because he was like end-stage liver disease and had respiratory failure and renal. He was just a very complicated patient to learn a lot from. Well, one student had the patient, and that student's friend had the patient a couple of weeks before, and they verbatim copied and pasted the care plan. What? Yeah, so that can cause you to fail clinical, all right? Don't do that. That's stupid, all right? So remember, don't do anything stupid. If in doubt, don't do it, all right? Ask somebody. Do you think I might fail clinical for this? If you have to ask yourself that question, don't do it, yeah. Handbook, clinical procedures, we talked. That's in the handbook. You can't record in clinical. You can't even record post and pre-conference, right? Because we talk about patients. We mention patients' names. We mention detailed private information about those patients. In this classroom, I will talk about patients too. I'll say, Elizabeth, you have this patient. Let's tell me about, what happened, and we'll link it to class. But we won't mention the patient's name, all right? But in the clinical situation, you're probably going to be mentioning the patient's name, all right? So, if we say, tell me how Bill Smith did today, whatever, so you can't record in clinical at all, even if you have a disability. I think you guys know now to not communicate patient information anywhere except inside that nursing unit, all right? It always happens that we get to the lunch, because I like to eat lunch with you guys, so we sit down and we talk, and everybody wants to talk about their patient. We got plenty of time to talk about your patient. Let's talk about other things while we're sitting in the cafeteria, because that patient's family member might be sitting right next to us and you don't realize it. Maybe that patient has HIV and the family doesn't know. And then they said, they're talking about Bill over there, and they said he has HIV. We would be in a court in front of a judge, people. All right? So don't do it. Just don't talk about patients outside of even if you're in the elevator and it's just us, just make it a practice not to do that in your everyday practice as a nurse too. Because you just don't want to be called to some corporate's office because you did something like that. God, that would be terrible. All right, what is this? We talked about all this. Everybody has malpractice insurance, TB skin test. All clinical days are required. You must attend clinical for 12 days during this semester. All right. If you can't, you have to notify me or your instructor beforehand, and we will work it out so that you can get those clinical hours in. It's not because you just have to do it. There is a requirement by the NLN that every student that graduates has at least 630 clinical hours when they graduate. All right. So, just if you need to miss, let me know beforehand. So don't not go to clinical on Wednesday and give me a call on Friday and say, hey, I missed. Have you talked to your instructor? No. Well, you failed clinical. All right. So don't do anything. That's something that would be considered stupid, right? Be prepared for clinical. Always use universal precautions, and that means you do hand hygiene and you put gloves on if you have the risk of coming in contact with bodily fluids, right? You don't have to put gloves on to give a patient a pill, all right? You don't have to put gloves on necessarily all the time to do a physical assessment, all right? So you use your good judgment on when to put gloves on, but it's always best to put them on than not. But you can offend a patient sometimes by putting gloves on when you're doing something simple, all right? Dress code, you guys know how to dress. Make sure that you have white shoes on. Make sure that they're clean, that your lab coat doesn't look all wrinkled. Make sure that you look presentable, because me and yourself, we all represent the school. So we have a very good reputation in this community, and we want to keep it that way. So if we come into clinical looking, all disheveled, I'm like, what's up with these people, What else? Yeah, I think you guys know all this, but it's all here if you want to read it again. Like number 10 would be considered doing something stupid, What else? I'm not sure how you guys are used to doing your evaluations for clinical, but what we do in this clinical is you evaluate yourself. At the end of the syllabus, we'll look at it real quick in a minute, and you go through and say, I am satisfactory in all of these learning outcomes or whatever. And then your instructor will go through and they will say, I agree, I agree, I agree. And they'll put some comments in, good job doing this, blah, blah, blah. All right, so you bear the burden of doing your own evaluation, and we simply concur with it usually. All right, 99% of the time. And don't bring anything valuable to clinical if you can help it. What else is there that's important? if by chance, you've got something going on at home, maybe your mom is having surgery that morning, and you really need to get that phone call when she gets out of surgery to make sure that everything is okay. That is totally fine with me. Just put your phone on vibrate, keep it in your pocket, and you can go into the conference room and talk to your brother about your mom if you need to. All right? So, but just don't let your phone ring in clinical. It's extremely unprofessional. All right? And don't text while in clinical. I find this kind of silly, even at the med. The majority of you guys will be at the med. They don't want to see a phone at any time. For me, that doesn't make sense because I pull out my phone to look at Hippocrates, to look up meds and things. But if you need to do that, if you have some sort of app on your phone that you need to look something up, just go into the conference room to do so. Don't whip it out standing at the nurse's station on your cell phone because it just looks bad. I think that's probably why they don't want us to do it, because it just looks bad. You've already signed that. Let's see. All right. All right, you've already signed this page saying that we went over the syllabus and you have a copy of the syllabus. Technically, right now, not everybody has a copy of the syllabus, but you will tonight. All right. This is the clinical evaluation tool. So in these columns down here, you will either put a S or a U or a not applicable in the self-evaluation column. Where is it? You might have seen this before. So you'll just put a check or an X or an S in this first column saying, yes, I'm satisfactory in all these things. And there, so here's the little starred items. So this must be satisfactory, right? All of them to pass. And you can make comments at the bottom of each page saying, for instance, I did this or whatever. I think I'm really good at this, or I need more work on this, whatever you want to say. Because this goes in your permanent file. And then for me, for my group, I don't really require that we sign this because what we do is we do it all through the Dropbox. So you're going to do this, you're going to put it in the Dropbox, I'm going to open it up, put my stuff in, save it, and load it back up as feedback. I can see if you've read your feedback. I can see, it says, Heather read her feedback, and on this day at this time. So that's your signature. I know you opened it. All right. And then that goes into your permanent file. Oh, did I give y'all this? I didn't. You had to sign this too. So we'll do that on Thursday. So you have to sign these pages for clinical too. You have to initial all these parts. All right. So that's the syllabus for clinical. Any questions about the syllabus? Probably not. Let me just open this so you can see it. If you haven't yet, this is the access to TCPS. Remember, this is the general access, and then you have your own personal access to get in to take those quizzes. All right, let's update this real quick. So, Section 201 is me, all right? If you're in Section 202, I believe that's Ms. Barden, and you also be at the med in GICU, where I am, on Saturday. I'm on Monday. If you're Section 203, you're at Methodist Germantown. That's the Wednesday evening class, I think, and that is with Ms. Tricia White. If you are in Section 204, you guys are very aware of what's going on. You have Ms. Chandra O'Brien. She is fantastic. You'll like her. And also, Section 205 is Melverdine Young-Smith. You will be with her at the med in the PCU, which is the ICU step-down, kind of, but it's actually more acute than a step-down unit. And Section 206 is on a Friday in the morning. So it's Friday from 6:30 to 3:30 in the afternoon. So there's the answer to your question if you're in that clinical. I think there's only 5 of you in there. I think some of you might have to switch to that clinical. I don't know. But Section 206 is on a Friday at the med, right? So if you're in Section 206, facility-specific orientation will be the med. And you'll be in the PCU. All right? It's an ICU step down. Yeah. Any questions about that? Everybody knows where they're going to be. You know what section you're in. Let me say this. If you are needing to switch a clinical for somebody, it's probably not going to happen. Okay? It's not. I don't do that. I'm not responsible for registering students for clinical. It is your responsibility to register yourself for a clinical, and if you need to switch, that becomes the department chair's responsibility. Okay? So I don't think that she is probably going to be switching people around. It takes too much time and effort. Usually when people need to switch a clinical or do something different, it's because they wait till the last minute to register, and that's not my fault. All right? So where you are is where you're going to be. All right? If you're not in a clinical, you've got to register for Section 206. And you need to do that tonight if you haven't. Is anybody not registered for a clinical? I hope not. Okay. So where you are is where you'll be. And if somebody really has an extenuating circumstance that really needs special considerations, we can talk about it. But, yeah. All right? Understood? Sorry. But I did my best this semester to get everybody in an acute or a high acuity setting, which is nice for adult health too. Looks like this is something else I haven't posted yet. This is the schedule. All right. So you people who are at the VA, your clinical orientation will be on the first day of clinical, which is September the 7th. I'm pretty sure that Ms. O'Brien has listed out detailed instructions on pause already, so you should know exactly where you need to be and what you need to be doing for that clinical. She does her first clinical day as the orientation, and for the first half of the morning, you go over computer documentation. For the second half of the day, you go and actually take a couple of patients. If you're at Methodist Germantown, your orientation will be on the 4th, which I think is the first day of clinical. The med is always unique because the med always has more than one section. I'm always at the med, and I'm the only one that knows how to teach people how to use the computer charting system. So I have to do the orientation for all groups at the med. So, and we get in when we can get in. So I sent out an email about a week ago, maybe 5 days ago or so, and let you guys know that if you are at the med, you will be needing to do orientation on next Thursday at 2 p.m., all right, 2 to 5, and then we will run over here and do lecture, all right? So if you have a schedule conflict with that, let me know, and I will try to work something out with you. But and I realize this, and I'm the only faculty in that's STCC Student Nurses Support Group, okay? I see that you guys make these comments that this really isn't a night weekend program. Well, I agree, okay? But I don't make the schedules. That's the way it is. But just be aware that sometimes clinical things, especially for clinical, have to happen outside of the clinical time because, we can't go on a Saturday over there because they're not there. We can't get into the computer lab. And I do my best to put it as late in the afternoon as possible for you guys. So if you work during the day, maybe you can get a half day off, or skip lunch or whatever. But so I realize that, and I sympathize with that. But that's just the way it is. All right.
Given that we'll be on the net on the non-clinical days, that means we'll be in our street clothes, our business casual.
Yeah. So what you'll do is you'll wear business casual clothes. That means no jeans, no T-shirts, no tennis shoes, right? You guys are grown-ups. You know what that means. No open-toed shoes. Look professional. And your lab coat. All right? So that's what you'll wear for the orientation day at the med. But for the other two clinicals, you guys will obviously wear your clinical uniform on the first day. All right? We will be meeting in the 6th floor Adams building at the med. Some of you may have been at the Med for clinical, but maybe not, because I think I want to say that Adult Health 2 is the only clinical anymore that does clinical at the Med, except for maybe women's, right? Childbearing. So if you did clinical at the Med for childbearing, for women's, the Adams building is directly across the street from the Route building. The Route building is the Women's Center. It's directly across the street. It's that old building over there that's 100 years old that they're going to tear down soon, which is kind of sad, but because I think it looks nice. But so yeah, they're going to tear that building down and build a new Women's Center there. But it's still there, so that's where we will have orientation on the 6th floor. So just take the elevator up to the 6th floor and hang out. All right, and I will see you there at 2. We will start with computer orientation, and I will show you before we leave how to start up computer orientation, because you have to get your access before we get there, your access to the computer system. All right, any questions about where your orientation is for your clinical? All right. Really, this clinical is a combination of Adult Health 2 and management. Okay, so we just merge it all into one clinical section, but it's really for both classes. So you technically have the clinical for management too, but we just put it in with this one. The first 6 weeks of your clinical, I often say this, but you VA people, you get treated a little bit differently. So if some things I say doesn't make sense, probably is not the case for you. But the first 6 weeks of clinical is a traditional clinical, right, for Adult Health 2. So this is where you will go the day before, pick up patient information, go home, do the research, come there the next day, somebody's breathing down your neck, you're given meds, right? So it's the traditional clinical where the instructor is directly supervising most of the things that you do. The management section is where you are placed in, VA people don't listen, you are placed in an area with a nurse somewhere. So, you know, maybe you've been with me in the GICU for 6 weeks and you're like, I really don't like this, you know. So you're like, I want to go work in the PCU, or I want to go work in on the floor. Some people like working on the floor. You know, LPNs are fantastic at being floor nurses, so maybe that's where they want to go back and work, and that's okay. So then maybe you want to do your management section on the floor. So what you do during management is you work very closely with the nurse. You take that nurse's load of patients and you manage that load of patients. Probably Dr. Masheri emphasized last night that management is not management of nurses, it's management of patients, right? Some nurses manage other nurses, but all nurses manage patients, all right? So that's the purpose of our management section, is for you to be in an area to learn how to manage a load of patients. I'm okay if you love ICU. I'll be your best friend because I love it too. And you can stay in the ICU for the whole time if you like. But, you know, you people that are in the PCUs, you're going to get some high acuity patients. You're probably even going to have patients on the ventilator down in the PCU. But if you really want to get some good ICU experience, you just tell your instructor, hey, can I go to the ICU for management? And they'll say, sure. All right? So we will do our best to put you where you want to be, but keep in mind that there are other nursing students in the hospital when you're there too, so you can't just go anywhere because that unit might be locked down with University of Memphis with 10 clinical students, and you can't get in there. So we will do our best to get you where you want to be. All right? The places where you can't go: OR, ER, and you can't work with like a nurse manager or something like that. You're going to be taking care of patients. Because when you work, when you work in the OR, you're not taking care of patients as a student, you're observing everything. And then when you're working in the ER as a student, it's really fun to work in the ER as a student because you get to do a lot of skills, but you're not managing anything. You're just a task doer when you're a student in the ER. So you people at the VA will get a couple of ER days, but she actually, I think, put you in there and you are responsible for those patients. But she has to be with you at all times. That's the unique thing about the VA. We can't spread you out over the hospital. The VA requires direct supervision of an instructor of all students at all times. So you can't be spread out of the hospital separately. All right. Does that make sense? What is going to happen for management? Okay. Like I said, we'll do our best to get you to where you want to be. For paperwork, generally I do about 4 weeks of paperwork. And that's probably what everybody's going to do. If you can't do it by now, there's a problem, right? If you can't make a proper nursing care plan database and put it together and make it look at least halfway decent, we need to have a meeting, right? Clearly, when you get your first API back, there's going to be some comments on it, and maybe you should have done it this way. Consider constructive feedback. People, we don't sit there and mark stuff up just for the heck of it. It takes a lot of time to evaluate a student's paperwork. So take it as constructive criticism and make the improvements, because if your patho still looks bad, at the end of the semester you're going to keep doing patho. You're going to do it until it's right. But the full set of paperwork, about 4 weeks. Until and you only have to go to get your patient assignment the night before if you do paperwork. So really only 4 more weeks of that do you guys have to do. Especially when you're in management, you're not going to go get your patient assignment beforehand. You're just going to show up and say, hey, I'm going to get these patients too. We're immersing you in the practice of being a nurse. So we want you to feel like you're being precepted by this nurse and you're learning how to do the job truly. All right? Because up until now, you maybe kind of feel like you can do it, but a lot of it's observation, especially in women's and peds. So any questions about that? Okay, so here we go. This little thing here. This is me and my people. So we have clinical on Monday, so you won't be in clinical during fall break. So we have to not make up that clinical, but we extend our clinical until December the 2nd. So we will end last. We start last and we end last. So just warning you now that you will be the only ones that have a clinical after Thanksgiving. Everyone else is finished before Thanksgiving. Just nice. All right, give you time to study for your test. Again, come to clinical. Always, if you have to miss, let us know beforehand. What else is there?
So we probably won't meet our instructors. If we haven't heard from them by now, we probably just won't meet them until that first day, right, at orientation.
Yeah, you won't meet them until then, but hopefully you'll get an email from them, maybe, at least saying, hey, I'm here.
Question. Last semester, Ms. Frederick took up all of our Methodist IDs and said we wouldn't need them anymore.
I know. Okay, so here's what happened. She came to me and she said, Jason, do you need your citizen IDs for Methodist? No. Well, sorry, yeah. Because I didn't know that there was going to be, we've never had a Methodist section, so you have to go through the whole process again. Sorry. That's my fault. Let me go through the database real quick. I know we're starting to run out of time. It's going to look a little bit different than what you're used to, but probably somewhat the same. So the beginning of always of the database is usually the patho. But right here, just fill all this in. And the chief complaint upon admission. Your patient may have a diagnosis of pneumonia and respiratory failure, but what was their chief complaint when they came to the ER? It wasn't, I have respiratory failure. It's, I had shortness of breath, maybe. So you'll have to investigate that. So you have to research the patient's pathophysiology. So what I want you to do is list things out. So first of all, you need to list out the patho definition to the cellular level. If you're not talking about a cell or an enzyme or a hormone or a reaction site or something like that, you probably need to dig a little bit deeper. Don't just say it's a bug in the lungs, pneumonia. Wrong. All right? And that would be the first section. So you would write out. Okay? So you would say, maybe just write patho. And you type some stuff. All right? Make it organized so that I know where things are. And then you'll come and you'll say, signs and symptoms. And you'll list it out. All right, those are the common signs and symptoms of pneumonia. Okay, I don't want a big long paragraph. All right, because like I said, you're going to get into this and realize that your database might be 40 pages long. It happens all the time. And I certainly don't want to read a whole bunch of stuff that's not necessary, and I don't want to read stuff that is jumbled up and I have to go hunting for stuff. So make it organized like this, list it out. So your patho, your signs and symptoms of that disease, how it's diagnosed, and how it is treated. Okay? So list all those things out in a organized fashion, not just one big paragraph. All right? Does that make sense? So the patho. You have to do the patho of the diseases that your patient has that we're working on. So if your patient is there for pneumonia and respiratory failure, that's what you need to do. I don't care that they have gout. You don't need to look that up. We call it a working diagnosis. It's what diagnosis, what is their problem right now? Why are they in the hospital? What are we working on to fix? Okay, whatever they're there for that visit. If your patient came in for DKA, what are you going to look up? Diabetes mellitus, right? And DKA too, right? Fill in all this demographic information. Don't leave anything blank. This one right here is often left blank, and I still don't understand why. If it doesn't say the patient's a DNR, what are they? A full code, right? How is your patient getting nutrition? What is their Erickson stage? Yada, yada. These things you're going to have to interview the patient or family for, and you need to list out what the patient takes at home, with their home medication. The Joint Commission requires that every hospital have a home medication reconciliation form on the chart, so there's no reason that you shouldn't have this information. The purpose of you having this so that you can see what has been changed. Maybe the patient came in a hypertensive crisis, the pressure was 220 over 110. Their blood pressure medications are going to be different now, so that you can see what has been changed. So that's an important critical thinking learning tool there, all right? So it seems insignificant, but it is significant. Every student in here will be able to evaluate an EKG strip by the end of tomorrow, Thursday, all right? So when you go into clinical, you will be evaluating your patient's EKG rhythm. Everyone's patient will be on EKG monitoring. Okay, so you're saying, well, how am I going to get my strip on here if I'm submitting this electronically? You're going to take a picture of it with your iPhone. You're going to scan it into your computer. You're going to somehow get it into here. If you just can't do it, I'll print a second strip for myself and take it home, and I'll be like, okay, this is the one he's looking at. But do your best to get that picture of that EKG strip up there, and we'll talk about all this stuff on Thursday. All right? I'm trying to hurry. All right? It's just an EKG strip. Right? Just make sure the patient's name isn't on it. Yeah. I don't think that an EKG strip is recognized under HIPAA. You know, I mean, as long as their name is not on it, it's okay. All right? That's the only thing you can take a picture of. This right here is your top 3 nursing diagnosis priorities, okay? Priority nursing diagnoses. So you must list out the top 3 in priority order. You must have a nursing diagnosis followed by related to and as evidenced by. You're big kids now, right? We all should know how to do as evidenced by. People still have problems, I understand that, because it's hard to do this. It's sometimes hard to put it together. But I always think about as evidenced by, it's going to be some sort of assessment finding. It's something that has led you to that diagnosis, okay? Even if it's a verbal report of pain, that's as evidenced by, okay? It's your assessment finding that led you to that diagnosis. It doesn't have to be all of them, because sometimes there'll be a lot of things that put together for that one diagnosis, but, you know, the main thing, all right? We'll work on that. Over here for nursing interventions, try to put in at least, 4 or 5 interventions over here in priority order that you're going to be doing to fix this problem. Obviously, all of your nursing interventions should be geared toward fixing your nursing diagnosis. So, I don't know, I mean, hypovolemia or deficient fluid volume, probably don't care if you're going to assess the range of motion. Like, it doesn't fit, right? This is not required, but you can use this as a guide for yourself of what medications are going to be given. The med is still old school, and they do paper Mars. I think that's the best way to do it, but we're the only ones. So you Germantown people and you VA people are all on computers, so you won't have a piece of paper in front of you reminding you what to take. You're going to have to look at the computer. But having said that, don't use this to administer medications by. Always use the official MAR, but this is to help you stay organized. Not required, okay? You can leave it blank when you turn it in. You've seen this before, right? If you were smart, you've typed everything you've ever done for clinical, and you can throw it in here. So probably everybody's had a patient on Nexium. Everybody's had a patient on Colace. So you're going to be pulling this stuff in from your previous databases. But don't just blindly copy and paste stuff. You have to make sure that it's applicable to your patient. Here's the best example. A medication might have the side effect of dysmenorrhea. If your patient is a male, That shouldn't be a side effect for your patient. All right? I swear that's a true story. Somebody did that. All right? Right here. So you see that for the medication, you need to be listing both names of the medication. So maybe it's Colace, but Colace is docusate sodium, right? So you need to list a generic and trade name, unless you're giving a trade drug and it doesn't have a brand name, okay? But do your best to do that, because you need to learn both names of medications a lot of the times. But learning the generic is most important. You need to list the functional and chemical class. What that means is that lisinopril is what kind of medication? It's an antihypertensive, right? That's the functional class, but what's the chemical class of lisinopril? It's an ACE inhibitor, right? For the mechanism of action, you need to give me the detailed mechanism of action of that medication, and also, the cellular level, right? But you also need to tell me that it's an antihypertensive, or lowers blood pressure, or lowers heart rate, or the therapeutic action, right? All of that is pretty self-explanatory. But make sure that this is concise as possible. The most important, the most common side effects, and the most important nursing actions and responsibilities that you're going to do for those medicines. It's inevitable. I'll get some puny medicine like Colace, and somebody's got something this long for side effects. Come on, all right? So just make it concise. Be nice to me. All right. These are labs. Labs are one of the most difficult things for students to comprehend and understand and figure out what to write down here. So, real quick, you need to do your pre-lab labs and you do the day of labs. We do that so that you can see changes, so that you can see trends. Your patient's crit was 12 this day. That'd be pretty bad. Maybe, but I've seen it. But crit 12 and maybe the next day it's 30. Well, you would look, they got 3 units of packed red blood cells. That's probably why it's come up. You need to list every lab on your patient, all right, that's current, right? Every lab, you should understand what it is, but obviously you're only going to be rationalizing something that is abnormal, right? Another example. So make sure that you're doing a good job rationalizing the abnormal labs. If your patient's H&H, I don't know, maybe the hematocrit is 30 and the hemoglobin is 10, right? Every time I get this. Over here on the interpretation side, somebody puts anemia. You're just restating the obvious. Anemia, the definition of anemia is low red blood cells, low hematocrit, low hemoglobin. Why is it low? Maybe your patient received 10 liters of normal saline yesterday because they were dying, and that's going to make their hemoglobin a little bit low, right? Because it's a dilutional effect, right? So, and then also, maybe your patient has chronic renal failure. When you have chronic renal failure, you don't produce erythropoietin. What is that used for? To produce red blood cells, right? So that's why it's low. Don't just restate the obvious. If you have white blood cells that are, 20, don't just say, elevated white cell count. Well, duh, so why is it high? Well, my patient has pneumonia, So understand why these labs are abnormal. Right? Don't just reset the obvious. Some of you are like, yep. You're gonna you're gonna do it too. You're gonna write something silly over there. All right? You need to do a narrative, a written format of your physical assessment. There is a physical assessment guide in here that you will remember probably in Foundations. So it's just a reminder. I realize that you guys haven't assessed an adult patient in about a year. So you're going to have to get back in the swing of it, because last semester you were in peds with these kids and you didn't even want to touch them. And then in mental health, it's a lot of communication and observing, right? So get back up on your physical assessment skills, because you're going to be doing very detailed physical assessments on these patients. Does everybody know how to do a focus note? Data, action, response. The data is the problem. What did you assess that lets you know that this patient had a problem? Patient states that pain is 8 out of 10, aching, in the head, intermittent, whatever. You're going to give that assessment information for the data. The action, what did you do about it? Reposition patient on left side, administered Percocet 5/325, 2 tabs times 1, right? And then your response is your reassessment of your action. All right, and how did the patient respond? 2 of these. You have to have 2 focus notes on every clinical day. It never fails. The student's like, I don't know what to write a focus note about. Well, if your patient doesn't have any problems, we need to consider discharging them, right? So they have a problem. Here's your API. You are very familiar with this, right? So you're going to do your API on your number 1 priority. On the other form, you had 3 nursing diagnoses in priority order. So your first one, probably, if you're in the ICU and the patient on the vent, is going to be ineffective airway clearance, right? So that's going to be your priority, some sort of airway thing. related to, and as evidenced by. And these assessment things down here, objective is what you observe or assess, and subjective is what the patient says, or somebody else says, or the chart says, right? And you need to make a goal for your patient, right? So patient, here I go, let's see. Patient will maintain a clear airway throughout this shift as evidenced by, non-copious secretions or minimal secretions or easy breathing, whatever. It has to be some sort of assessment that tells you when this patient has met this goal. And you also have to have a time frame by the end of the shift, by discharge, whatever. All right? You need to evaluate your outcome, all right? Evaluate that goal. I think you're probably noticing this. We don't do theory anymore, all right? So you don't have to do the theory section of your API. Your nursing interventions, you're going to have at least five independent nursing interventions. Listen closely. The first one or two should be an assessment, right? You remember Ms. Livesay? The first couple should be an assessment. The second one or two should be some sort of intervention, actual actions. And then the last one or two should be some sort of teaching, right? For interdependent interventions, you need to be doing at least 3 interdependent interventions. For me, some other instructors are different, but if your nursing diagnosis is pain, if your patient's on morphine and Percocet, that's 2 different interventions for me, all right? So you can list up those 2 separate medications that are going to fix that problem. Don't put Colace on here for pain, right? It's not going to fix the pain. Well, yeah, it might, but, All right, does that make sense, everybody? You need to, of course, have a rationale. Why is this intervention going to fix this problem? How is it going to lead to assessing this problem? And then an evaluation. They should all match up. So you need to evaluate every intervention that you do. If it was an assessment, assess lung sounds, Q2 hours. I need to know what the lung sounds were every 2 hours. If it was to administer Percocet, did you give it or did you not? So your evaluation. What else? Okay, and this is the last page of the database. So you guys will be keeping up with your patients hourly. You probably are used to maybe being on the floor, and maybe you only did an assessment every one time. You can see it once in the morning, right? But on our patients, if you're in the ICU, an ICU patient is physically assessed every 2 hours. They get vital signs every hour. That's why you only have 2 patients, right? If you're working in the PCU or step down, those patients are usually assessed every 4 hours, but you guys are going to do it every 2 hours. All right, you're going to do it more frequently, unless your instructor might want you to do it every hour. If you guys are at the Med and PCU, they've done some good upgrades, and they have bedside monitors now, which is fantastic. All right, so you're going to be keeping up with all this stuff: the temperature, the blood pressure. We'll talk about the difference between non-invasive and arterial blood pressure, heart rate. These are ventilator things. We'll talk more about that. ICP, which is pressure in the head, IV fluids, AccuChecks. If your patient's on any drips or drains, you're going to be keeping up with all this stuff. You're saying, well, I'm putting it in the computer anyway. Well, I need to see it too, because if your patient over here had a pressure of 120 for the first 3 hours in the morning, and then all of a sudden it's 170 over 100, what do we do about it? So I will give you a note about that and say, did we talk about this? What was done? What interventions were done? So that we use it as a learning tool. Also, urinary output, which is over here on the right-hand side. That's very important when your patient is critically ill. You're monitoring their urinary output hourly. And all these things in here. If you can't figure it out, that's PO intake, tube feed, flushes, IV piggyback. I still haven't corrected that because of BP. Blood transfusions, boluses, TPN, and urinary output. So you're going to be keeping up with all those things. Not all those things are going to be applicable to your patient, but keep up with what's applicable. So we're going to be late getting out of here. I'm sorry, but if you guys are at the Med, take one of these. Yeah. For the clinical paperwork, I think almost all the instructors, probably all of them, utilize the Dropbox. So for the clinical day, you're not going to put it in the Dropbox before you come to clinical. You're just going to bring a copy with you. So you'll print it out, which you have done before the clinical day. And these are you Methodist people. Where are you? Pass that back to Amber. You will submit your clinical paperwork. I'll give 2 days for clinical paperwork. But I'll make the Dropbox deadlines. Methodist people, Pass one more back, John. All the way back. All the way back. Methodist people. I think there's 2 in this row. Did you get one already? Are you No. Methodist? No, it's different. Pass this back. Methodist people again, God. 2 back, John. How many here? Just 1? And 2 there. And 2 over here, is that right? Oops, sorry. Methodist people should have 3 pieces of paper, right? 3 forms? All right. You want to have 2? What don't you have? This one?
Yeah.
Med people, that's most everybody. If you don't know your tag number, you can bring it to me Thursday.
You said it's not B. Young anymore, it's Y. Smith, Melvert E. Y.
Her last name is Smith. When you guys do your med orientation, it's going to come up at the end to print all these forms. Don't print them. This is one of them, and the other ones are not used anymore. Pass that back. If you don't know your instructor's name, just put my name.
You know how many days parking?
Just put August or September through December. Okay, you med people. This is where you have to go to get access to Sorian. Sorian is our computer documentation system. So you need to go to accessrequest.the-med.org. And don't worry about this HTTPS stuff, okay? Just write that down. Accessrequest.the-med.org. Is everybody okay? Which one is that? 2 more med confidentiality forms. There's probably one sitting somewhere extra.
8, 9 ownerships. What time's the morning shift?
Where are you? When? What? Who's your instructor? Morning.
So 7 to 3? You'll be on the floor at 6.
Friday and Saturday or just Saturday?
It's not a big deal. I don't care.
And what if
Just clinical day.
instructor's phone number for you?
You can put mine there.
Your email and your phone?
My email is JT, J like Jason, T like Thomas, Sasser, at southwest.tn.edu. My number is 90. If you don't know, hers is M Smith at Southwest, or excuse me, M Young at southwest.tn.edu. Barden is D Barden. Tony Barden is D Barden at southwest.tn.edu. If you already put mine on there, that's okay. Doesn't matter. What happens to these forms? They put them in a big file somewhere and they forget about them. But in case if something happens, you have been approved to park in this garage. Okay. Parking in the garage. Park on the roof, people. You have to park on the roof. My phone number is 901-652-1013. Don't call me.
What's the phone number?
901-652-1013.
The last date access needed, isn't that like
Huh?
11/27, last date access needed?
Oh, just put December 13.
Okay.
So we're putting your phone number instead of our instructors?
That's fine. Yeah. For the med people.
Employee or department?
No. You can on the med confidentiality form for department or whatever, you can just put STCC student nurse, okay, or nursing student. Sorry, I know you guys are ready to go home.
You said on what employee department? What did you say for that?
On the department, when you
Employee
put,
department.
STCC nursing student.
what did you say if we do not have our phone number right now?
Bring it to me Thursday. Yep.
We don't have anything for the phone number on the confidentiality agreement?